welcome to our virtual Food Summit Walk the Talk. I'm your host, Emily King from Spira, and joining me today is Kath Eastwood from Dietitians New Zealand. And we're talking about health. Thanks for joining us. Be sure to listen to the rest of the interviews in this series where you found this one. How are you this morning, Kath?
Not too bad. It's great to be here. Thanks for the invitation. And morena, everyone.
Thanks. Welcome indeed. And maybe just start with telling us a little bit about your role and how it fits into the food system so people understand that.
Yeah, sure. So my role is the General Manager of Dietitians New Zealand. So Dietitians New Zealand is the professional association for registered dietitians, dietetic students and associated nutrition professionals in New Zealand. So we represent and support around 700 members and who come from a wide variety of parts, I guess, across the system. So perhaps the traditional roles that you often think of with dietitians in terms of district health boards, or they're not district health boards anymore, but hospitals, food industry, business, public health, research, education. So it is a really varied profession. And we really work to build a strong and sustainable profession and we really want to be able to inspire change that supports the health and wellbeing of our communities. So like I said, we do cross quite a bit of many parts of the food system.
Yeah, amazing. Thank you. And thanks to all of your members and people that are here listening today. Kath and I have worked in the past about joining the health and sustainability sectors and other parts of the food systems together, and one of Kath's strengths is that collaboration and looking across it. So I think it's really important to note that. What do you find that the key challenges are for dietitians in your sector?
I think collaboration is one of the challenges, but we might come back to that a bit later. I think for us, it's really forming that connection between the role of food and nutrition and health, and particularly in the prevention, the management and the treatment of disease. So perhaps I'll explain that in a bit more detail. So if you think about prevention, so everybody eats, right? So everyone has a lived experience, and but food is so powerful. It connects, it inspires, it brings people together. It's a form of cultural expression. It's how we show love. It's all of those things. And I think the role of food in people's lives and their families' lives, can be really powerful. And often I think that's lost, and we all just end up talking about macronutrients and micronutrients. And when you think about that from a management and treatment point of view, from a disease state, is that there's overwhelming evidence between the connection of food and nutrition and health. Yet in a hospital setting or an aged residential care setting, the food service is coupled in with procurement and laundry services and not clinical services. And so the role and the power of food and actually the management and treatment of a lot of these conditions is completely overlooked. So that's a big challenge for us, and perhaps in the context of the health reforms is quite timely.
Yeah, I imagine. And thanks for bringing that to the fore. And so today we're going to focus in on the communication part, because obviously you've got those challenges and you've got that wide-reaching sector that's going into different settings, as you refer to them. And I'm just wondering, the first part of that is how Dietitians New Zealand communicates messages to its own audience around things. I've seen some of that messaging myself. I follow your Instagram and other things to stay informed, but I was just wondering if you wanted to share some of those tips to the audience today.
So I think for us it's really kind of just remembering who our audiences are, and so like you say, so if we think internally, so to our members, and then perhaps the sector and our health colleagues, and then the consumer, and what messages we put into those spaces. And like probably many of the organisations that and businesses that you're talking to today, we do have really limited resource, and so we have to be really strategic in how we spend that. And so I guess some of the things that we've learned along the way around how we communicate our messages is being really clear on what the purpose is. So, what are we trying to achieve with this communication? And then what do we want to communicate? And probably more importantly, who might be able to help us get there? And this is, I think, where collaboration becomes really important, because it doesn't just need to be dietitians communicating the messages. And a couple of examples. So Dietitians New Zealand commissioned a report last year with the New Zealand Institute of Economic Research into the value of nutrition. And actually, when we went to communicate that, it wasn't actually us that did the communicating. A GP did that on our behalf. And when you think about the prevention space, I think about, the role of consumers in that space, and the great work that David Latelli's been doing, and how much somebody with a really powerful lived experience can be in communicating those messages. And I think BBM is a really good example of that. So
you want to just explain to people what he's doing, because people might not know about that.
So David Latelli runs a community, I don't know how you describe it, it's just kind of wraparound support for people who need it in there to improve their health and well-being. And so he runs some fitness classes, and he has some social supermarkets, and some all sorts of things, cooking, and and even I heard him speak the other day, and it's everyone's role to be involved. And so even the doctors that are there to help manage those with long-term conditions are there to be involved. So they're not there just to turn up and do a consultation, they're there to take part and be alongside their patients. And so if you turn up in a suit and tie, doesn't really work. So
Great. So let's cut into some of the things that you're trying to share within that, and that may come into your value of nutrition report, it may not, but what are we'll frame it this way: what are some of the myths or misconceptions that you see communicated, and then what are the accurate things that you'd like people to do?
So this is a really interesting question. I think I could talk for most of the day on the myths and misconceptions of nutrition and dietetics. I think probably the ones that spring to mind would be, dietitians do diets. There's one perfect way of eating. There's a one box fits all. But actually, people choose foods for all sorts of reasons, right? And it's not our role to judge, and we have to walk alongside people, understand their unique circumstances, and really support them in their food journey. So whatever that might be. And so I think that often we get perhaps put into a bit of a box around that, and that's where I think the power of collaboration can be really powerful.
Yeah, because it's extremely complicated if one size doesn't fit all, and people want that, the main understanding of things. What would your tips then be for businesses? Say I run a food business and I want to better understand health claims around some of my ingredients, or even my product that I want to start, or that I'm trialing. What would some of your tips be for businesses when it comes to understanding or sharing these messages? I guess in this case, it's a hypothetical product. That's more hard for you to give examples on specifically, but just tips. So, whether that's how to research or who to ask or a good source. I mean, I know when I'm researching, it can be challenging in the internet time of too much information. How do you know who the accurate sources are? And you don't have access to scientific journals or the intel on that. If you're setting up a food business, you've got something, you think it's going to be healthy for people, or, you know, and you want to get it out there. So what do you suggest?
Yeah, I think that connecting with people is really important, and it might not always be that initial connection, but it might be, you know, that person can connect you with someone who is better placed to provide some of that understanding. And yeah, so for me, that's really, I think one of the most important things, and one of the most important things I've learned as well, is that you know, reaching out and being curious and really trying to understand something in the first instance is really important, because otherwise you get your messaging, you know, your messaging isn't always, doesn't always touch the people perhaps that you want it to touch. Yeah, if you don't have a good understanding of what it is you're trying to communicate.
And would people reach out to your organisation or find someone locally? I mean, would you be searching for a local dietitian, and how do you know they know what they're talking about?
Yeah, it's a really good question. So I think in the first instance, probably Dietitians New Zealand is a good connection, and that we can then connect you with the right person, right? So like I said, we support 700 members, they work across the food system. And so, you know, we have connections in other places as well. And so, you know, we could definitely connect people, yeah, perhaps with the most appropriate person for their circumstance. Yeah.
Great. Is there anything else you wanted to add or share this morning?
No, I just wanted to say that just on that collaboration piece, I think it is really important. We've just become so good at working in silos, and you know, so much more can be achieved by working together. I think, you know, I heard a saying not that long ago that was, you know, faster alone, further together. And I think that's so true when we're trying to tell a food story. And I just want to give you an example in the health space, and it's to do with it's actually to do with food service, but you know, with the health reforms, we got emailed about the number of meals offered in hospitals in New Zealand that were vegetarian or vegan. And so, you know, which I think is a good question, but perhaps a better question was around what's the proportion? And when you think about that, you know, across the day, 100% of breakfast meals are vegetarian that are offered in hospitals. You know, and so is the majority of the other food. But actually, more importantly, is, you know, what is some of the other really low-hanging fruit? And when we think about food waste in a hospital, if you take a big hospital like, say, Waikato or Auckland, that are 35, 40 ward hospitals, the way that that food service is delivered in New Zealand is quite archaic, and so nothing is done in real time, and so there's a huge amount of food waste. And so if one meal is wasted per ward per meal every day, which, just let me tell you, is a huge underestimation of food waste in New Zealand hospitals, that equates to over 40,000 meals wasted every year just in one hospital. And, you know, so I think there's so much more that we can do together by being curious, asking really good questions. Yeah, so I think, yeah, further together.
Thank you so much, Kath. It's a really strong message, and I think, yeah, it's a great, it shows in your work that you do that collaborative approach. And I hope that people listening today or later do reach out if they have health questions. For those of you who don't know me, I take a food systems approach. So we're looking at the full food system. That's our growers, producers, manufacturers, processors, right through to retail. And then where the food goes and who's eating it, and also the waste along the way. And health is often, bizarrely, an overlooked and underrepresented part of that conversation. So collaboration extends right across the sector, and thank you for talking about food waste and bringing that into the conversation today. Lovely to chat to you, Kath. Thanks for joining us today. I'm your host, Emily King from Spira. Be sure to check out the rest of these interviews where you found this one. Thank you.